We are thrilled to welcome you to the next impactful episode of Concorde Conversations. This is a new initiative by Concorde Medical Group to educate, empower, and inspire our community about their health. So today's discussion is the highs and lows of blood pressure. I'm Dr. Catherine Weinberg, and I'm joined by two of the top cardiologists, Dr. Aeshita Dwivedi and Dr. Lauren Rosenberg. So before we begin, let's set some ground rules. First, we will be recording the session. So if you do not want to appear on the recording, please stop your video. Second, please remain on mute during our discussion to avoid distracting others. Lastly, many of you have already sent in excellent questions, which we will be discussing today. If you have any additional questions, please ask them in the chat box. We only have 30 minutes together, so we will try to go through as many as we can. Remember, we are giving general guidance. If you have a particular question about your health, we want to help you. So come in for an appointment so we can answer your questions and give your health the attention it deserves. So let's get started. So Dr. Dwivedi, according to the CDC, nearly half of all adult Americans have hypertension. What is hypertension or high blood pressure?
Good afternoon, and thank you for the introduction, Catherine. So let's start by talking about what high blood pressure really is. So basically, your vessels and your heart maintain a certain pressure to deliver the blood to the rest of your body. At times, what can happen is the pressure can be too high or too elevated, and this can occur due to multiple causes, including issues with the heart or the blood vessels itself. But at the end of the day, what it really does, it impacts all the important organs in your body, like your heart, your brain, your eyes, and your kidneys. Because when the blood pressure is elevated in the body, your organs have to really work overtime to function optimally. And that's really what the essence is. We usually measure it based on two different readings. One is the upper number, one is the lower number. The upper number tells you the blood pressure when the heart is beating, and the lower number is what the blood pressure is in your blood vessels between each heartbeat. And on the slides, you can see what the normal and what the elevated blood pressures are. Typically, the cutoff is 140/90 for the general population.
So Dr. Rosenberg, only 1 in 4 patients with hypertension have their blood pressure under control. What does it mean to have your blood pressure controlled? What are the blood pressure goals? Are there different goals for different ages or diseases?
Great. So, excuse me. So on the slide, you can see some general guidelines about what elevated blood pressure is, and there are different stages of hypertension. There are different goals depending on age and underlying disease processes. In general, as a cardiologist, I like to see the blood pressure 130/80 or lower, but that can become more liberal depending on your age, and it can become more strict depending on underlying disease processes.
Okay. So one of our viewers stated that every time they go to the doctor's office, their blood pressure is increased. They have been told they have white coat syndrome. What is white coat syndrome? How do you know if you have white coat syndrome or hypertension? And is there anything you can do to prevent it?
Yeah, definitely. So white coat syndrome or white coat hypertension is essentially a phenomenon where when you come into the doctor's office, you're typically more anxious. You've also walked in usually, or you may be running late. And all these things can elevate your blood pressure. So sometimes what happens is the blood pressure readings in the doctor's office may be elevated as compared to what you generally are at baseline. The way to really distinguish this is your doctor may ask you to keep a blood pressure diary at home, or they may even order a 24 to 48 hour ambulatory blood pressure monitor for you. However, having said that, the recent data suggests that the syndrome or this phenomenon is not completely benign, and this may be a precursor that you may develop high blood pressure in the future. So definitely it's important to recognize it and also follow up with blood pressure readings.
Right, so I was just gonna add that, you don't want your blood pressure to be good only when you're perfectly relaxed and everything is absolutely mellow. You want your blood pressure to be normal throughout most of the day. And if you're somebody who gets white coat hypertension, you're also probably somebody whose blood pressure is peaking during other, stressors and activities during the day.
So does hypertension increase a person's risk for other diseases? What are the consequences of hypertension?
Right. So I think that's the thing that we care about, right? So hypertension itself is not a problem. The problem is that the hypertension affects all of the arteries of the body. And when you have long-standing hypertension, it causes both stiffness in the arteries and it causes plaque to build up in the arteries. And that can affect almost every organ. Most importantly, the heart, brain, and kidneys and eyes also tend to be the most affected by hypertension.
Okay. So how can a person distinguish between the symptoms of hypertension or another problem? For example, how can you tell if your lightheadedness or your headache is due to high blood pressure?
Yeah, so blood pressure is really called the silent killer, and there's a reason for that. And a lot of times we don't realize our blood pressure is high. And when you do start to develop symptoms of blood pressure, that's really, a later stage of blood pressure. So if you are having symptoms from high blood pressure, that means it's either very elevated or you've had it for a prolonged period of time. Having said that, the symptoms of blood pressure can be very generalized. It can include headaches, visual changes. Some people may feel like they can't exercise as much as they usually did, or they're having trouble climbing the flight of stairs that they were previously able to do comfortably. These are some of the generalized symptoms, but having said that, because they're so general, you really have to sort of seek your doctor's advice to figure out if these symptoms are related to high blood pressure or not.
Right, and I would just add also that, some of the symptoms are from the high blood pressure itself,
Right.
Like acutely people sometimes develop headache or vision trouble. But then there are the symptoms of long-standing hypertension or high blood pressure, like chest pain, shortness of breath, etc.
Yes. So many viewers have been told recently to get a home blood pressure monitor. How do you use it properly to measure your blood pressure? And what's the difference between a wrist cuff or an arm cuff? Which is better? Can you show us how to take your blood pressure?
Definitely. So I can demonstrate on Dr. Rosenberg. So the important thing is that the blood pressure cuff should typically be at the level of your heart. So you want to take it typically at the arm, and you want to make sure that the blood pressure cuff is snugly tied around the arm. And usually your blood pressure cuff, this is the artery in your sort of the inner part of your elbow where the blood pressure cuff picks up your heart rate and your pulse. And there is typically a line which is actually hidden under the cuff that should be aligned with the artery over here. And again, just to make sure, the arm typically should be done at the level of the heart. So you shouldn't, obviously raise or
hanging down
right
here.
And then, you typically press the button on your machine and you'll get the blood pressure. Now, having said that, a lot of blood pressures are risk-based. In my personal opinion, the wrist blood pressure cuffs are not as accurate as the ones that you do on the arm. But, something's better than nothing. So if you can only get your hand on the wrist cuff, that's okay. The important thing is to bring your blood pressure cuff into your doctor's office so we can actually corroborate it with how it measures according to our blood pressure cuffs and also your manual blood pressure.
Right.
Yes.
So I think that's an important point. So if you bring your cuff into the office, we can make sure that the readings that you are getting at home are similar to the readings that you would get if you were in the office. I think also importantly is just to make sure that you're seated and relatively relaxed. And if you want to compare, from day to day to make sure that you're taking the blood pressure under similar circumstances.
Yeah. And when you have those readings, bring them in for us to review.
Right.
So readings vary a lot depending on the time of day. Does blood pressure run higher at night or during the morning or in the morning?
So it does vary during the day. Blood pressure is always lowest during sleep when you're most relaxed. It starts to rise in the morning just before waking, and it tends to peak in the afternoon. Again, it also depends on your activity. If you run up a flight of steps and then check your blood pressure, it's going to be higher than if you're laying down watching TV. So the normal variation is lower during sleep, peaking in late afternoon, but obviously varies with activity as well.
Mm-hmm. All right, so let's move on to medications for a little bit. What are the basic class of blood pressure medications? Many people ask which ones are the best, and can you tell us a couple of the risks associated with some of them?
Sure. So I really like to talk about the ABCDs of blood pressure pills. So A is for ACE inhibitors, or ARBs, as we like to call it, and that really functions on the neurochemicals released by your kidneys. B is for beta blockers, and these medications are also very commonly used in patients with heart disease or angina or heart rhythm disorders like atrial fibrillation, which is very common. C is for calcium channel blockers. So this includes amlodipine or nifedipine, which are the more common ones. And these really act on the blood vessels to sort of dilate the blood vessels a little bit. And then the D stands for diuretics, which is commonly HCTZ or hydrochlorothiazide, or furosemide or Lasix, which is often also given to people with congestive heart failure.
Mm-hmm.
Now, the next question is, well, what is the best? And I think it has to really be individualized to the patient. So if you have underlying heart disease or AFib, I would probably favor beta blockers. Having said that, typically based on the ACC/AHA guidelines, ACEs or ARBs, calcium channel blockers, and HCTZ are really the first line. Having said, and also your race matters. So, studies have shown that if you're African American, calcium channel blockers may be more effective in you as compared to Caucasians. So there's really no one perfect one for the general population. And the take-home message is it needs to be individualized based on your comorbidities and also your demographics.
Mm-hmm. Great. All right. What about exercise? We always, as doctors, recommend exercise to lower people's blood pressure, but exercise raises people's blood pressure during the actual exercise itself. How does exercise work? How does exercise lower your blood pressure in the long term?
Right. So as you exercise, your heart beats faster and stronger, and that's what causes the top number of blood pressure to rise as you exercise. And you want that because you need a higher pressure and more blood volume in order to supply your working muscles with oxygen. The bottom number, interestingly, does not change very much during exercise because it's the top number that's really dependent on what the heart is doing. So it is true that the blood pressure does go up during exercise, but what actually happens is that exercise causes positive changes in your arteries over time that makes them more compliant. And you can kind of see in the graphic here that exercise causes more compliant arteries, and ultimately that's what causes lower blood pressure. So the heart becomes more efficient at supplying oxygen to tissues, the arteries become more efficient at supplying oxygen to tissues, and your overall blood pressure and arterial compliance decrease. So in the long run, exercise definitely lowers blood pressure. And mostly what I'm talking about is aerobic exercise. I'm not talking about heavy weightlifting. So it's really daily or nearly daily aerobic exercise that decreases blood pressure.
Yeah. And by compliance, you mean the stretchiness of the arteries.
Sorry.
Right?
Yeah. So compliance really means like how well the artery can stretch in response to pressure.
Mm-hmm. So how often should we be exercising, and at what intensity?
Yeah, I mean, that's a great question. Again, I would preface by saying that it needs to be individualized based on your age. Obviously an 80-year-old cannot be exercising the same as a 30-year-old. But ACC/AHA does recommend at least 20 to 30 minutes of aerobic or cardiovascular activity, which we can go into at least 4 to 5 times a week. So it doesn't have to be every day. And even things like brisk walking or climbing up a flight of stairs, or even, believe it or not, household chores do count as moderate cardiovascular activity. So bottom line is anything that gets your heart rate going, anything that elevates your heart rate, and anything that sort of you feel comfortable with. So you know your body the best, and as long as you're not in discomfort because of exercising, you can keep raising the intensity over a period of time as to where you feel comfortable.
Right. And I was just going to add that, if you look at data for exercise and building exercise capacity, really the thing that actually improves cardiovascular fitness is interval training. And I don't mean like, you have to get down and do burpees, but I mean, what you should do is, if you're going to go for a walk, for at least 20% of that time, you should try to pick up the pace or go up a hill so that some of the time you feel a bit out of breath, like if you were walking with a friend that you couldn't completely hold a conversation.
And to elevate your heart rate.
Right.
Yeah. All right, let's move on to diet for a little bit. What's a recommended diet for someone who has hypertension?
So I think when we think about high blood pressure, mostly what we think about for diet is salt. And salt is definitely a key factor in controlling high blood pressure for many people. So really, the number that we usually use is 2 grams of sodium. So we think of trying to stay less than that during the day. So if you look at a package label, anything that has 400 milligrams of sodium or more is considered a high sodium food. So we really should be avoiding those foods. We should also be avoiding adding table salt, extra salt to food, and we should be trying to cook at home just because the nature of takeout is to put a lot of extra salt because it tastes good. The other part about diet is just that, what we're really trying to prevent with, controlling high blood pressure and controlling hypertension is to prevent atherosclerotic disease. That's one of the main things we're trying to prevent. So the way to do that is also to do one of the forms of sort of plant-based eating. So all of the healthy diets, I like to call it plant-based, not because, and they all give different kinds of animal protein recommendations or no animal protein, but the majority of healthy diets, the main component is that the majority of your intake is coming from plants. So low sodium plant-based diet would be the best way to control your blood pressure and prevent the consequences of high blood pressure.
Right. And just to add to that, I will say everything that we buy over the counter typically has a lot of hidden salt. So it's important to learn to read the labels. So when you're buying any processed food, any packaged food, make sure you read how much sodium it has, because there can be a lot that's hidden in there, especially because salt is used as a preservative in a lot of foods. And then the other thing I just saw a question pop up is, how does salt increase our blood pressure? So the way I like to explain it is the more salt you eat, the more water your body retains. That's one way your blood pressure goes up. And then the sodium itself can lead to stiffening of the blood vessels of your body, which in turn elevates your blood pressure.
Right. And there are some people, this slide here is showing sort of a population-based study. There are some people that are extremely salt sensitive, that if, you give them a salt load, their blood pressure will go up 10 millimeters of mercury. There are some people who have different different kind of kidney function, different response to salt, who are not particularly sensitive to salt. So this is sort of a general assumption that most of the population is at least somewhat salt sensitive, but there are definitely variations between people and how sensitive they are to salt.
All right. What about any tips on how to lower blood pressure besides medication and exercise and lowering salt in your diet?
Right. So there's a couple of other things that, there is data on. I will give these recommendations with the caveat that this should be done in conjunction, with your physician, and possibly, if you're hypertensive, to think about doing this with blood pressure medications. So garlic supplementation and high garlic in your diet has been shown to improve high blood pressure and possibly prevent hypertension. Hibiscus tea is another food that has been studied for the control of blood pressure. Ginger And then also sometimes if we're missing potassium in our diet, that can also cause increased sodium absorption by the kidneys and also raise blood pressure. So bananas, avocados, other foods that are rich in potassium are also an important component to making sure that, that our diet is healthy and balanced.
Yeah, and then other small things like caffeine intake. So caffeine raises your blood pressure, so it's important to limit or at least moderate the amount of caffeine. Alcohol, again, if for women, it's no more than 1 drink per day, and for men, no more than 2 drinks per day. But if you are consuming a lot of alcohol, that can lead to high blood pressure. And then stress management, really, I think the last year has been a very stressful for everybody, but whatever kind of stress management techniques you can incorporate into your life, whether it be meditation, cardiovascular activity, that also has been shown to be beneficial.
Sure. Yeah, I just wanted to add one more thing, which is that if you snore or you notice that you're very sleepy during the day, that can be a sign of sleep apnea. And sleep apnea is definitely a major contributor to hypertension and also to other cardiovascular disease. So snoring not only annoys your bedroom partner, but it's also dangerous to your health. So if you do snore, it's definitely something to discuss with your physician.
And one last note, smoking also raises your blood pressure, right? So we need to make sure everyone knows, stay away from cigarettes. Okay, here's another question from our viewers. She stated that her blood pressure has always been good. She's postmenopausal, in excellent health, exercises, and maintains a steady weight. But lately her blood pressure has been creeping up. So both of her parents have high blood pressure. What should she do? What can she do?
Yeah, I mean, I think it's a great question. And the fact that she is perimenopausal and or approaching her menopause also plays a big part, because women typically are protected from heart disease and other conditions like high blood pressure by the estrogen in our bodies. So when we start to reach menopause and lose that helpful or beneficial impact of estrogen in the body, we can, the blood pressure can get elevated around that time. So I think it's important to keep on top of the blood pressure readings, whether it's, by physicals every couple months with your primary care doctor or your cardiologist, incorporating a healthy lifestyle, and also, obviously, if needed, medications, which is really the last option.
Yeah. So is it better to take your medication in the morning or the evening?
Right. So for most medications, especially the antihypertensive medications, it does not really matter. You can take them any time of day as long as you take them the same time of day. So if you're going to take them in the evening, always take them in the evening. If you're going to take them in the morning, always take them in the morning. So most of them are meant to last a certain amount of time. So usually 24 hours. So if you're not taking them at the same time of day, then you're having more peaks and troughs of your blood pressure than you should.
All right, let's look at the chat box. All medications have side effects. So can you talk about some of the most common side effects of the medications? And what's the difference between the dangers of the side effects versus the dangers of hypertension?
Yeah, so very rightfully said that every medication has side effects. The biggest and the most common side effects of high blood pressure medications is lowering of the blood pressure. So the most common one that we see is it can lower your blood pressure too much, cause you to be dizzy or lightheaded. That's the big class. And then if we go into individual ones, the calcium channel blockers, like I mentioned, amlodipine, nifedipine commonly can cause swelling in the ankles. Again, less dangerous, but it can be an annoying symptoms, and we can use other medications. For the diuretics, it can impact your kidney function and also make you go to the bathroom very frequently, which of course can be annoying for people who have issues with the frequency of urination. But overall, I would just like to preface by saying that, studies have found that if appropriately used, the medications have a lot more benefit than side effects. And it really has to be individualized based on whether you have diabetes or whether you have kidney function or liver function problems. So talk to your doctor and find the one that's best for you.
All right, here it's an interesting question. They ask, they switched to a vegan lifestyle, exercises, does cardio, gave up alcohol, but they still have high blood pressure. Why?
Yeah. So, I mean, again, every person is different, and, I would have to hear the whole story, to know if there's some underlying issue. But, we call it essential hypertension. And the reason we call it essential hypertension is just because we don't really know what causes it. It's just there. And a lot of it is just genetics. So whatever you've done, as far as your lifestyle changes has definitely, has definite benefits to you, whether or not your blood pressure has completely normalized. So you're doing great if you've made all of those changes, and you've definitely had a positive influence on your health. You may just need blood pressure medication, and you should still continue doing those things, whether they've completely resolved your hypertension or not.
Yeah.
And just to add to that, we're all born with a certain set of genetics.
Sure.
Like I like to say, some people have brown hair and some people have black hair. Similarly, some people are more prone to blood pressure, but don't let that minimize the effect of lifestyle, because if you weren't following this healthy lifestyle, you'd be 10 times worse than where you are right now.
Sure. And I think all of the risk factors for coronary disease and stroke, it's not like 1 + 1. They are, significantly impacting each other, not just in a stepwise fashion. If you have both diabetes and high blood pressure, your risk is exponentially higher than if you just have one of those conditions.
Yeah. So how often should someone with hypertension see a cardiologist? So when should someone see a cardiologist?
So at least once a year, just to make sure that you're on the right medications, your blood pressure goals are being met. And also sometimes we can find reversible causes for high blood pressure, like thyroid disorders or kidney disorders. So we would also need to work that up to make sure that there's no other causes that are leading you to have high blood pressure. So at least once a year.
All right, so here's the last question. If you had one action step to recommend to our viewers to improve their heart health, what would it be?
I mean, mine is always going to be exercise. So whatever you're doing, add a little bit of aerobic activity. And that would be my number one recommendation.
Yeah, I think get moving, and also stress management strategies, because that plays a big part in your overall health, not just your heart health.
Yeah, yoga, Pilates, all of these have been shown to lower a young person's blood pressure.
Yeah.
So we want to thank everyone so much for tuning in to another informative and impactful episode of Concorde Conversations. We hope we answered many of your questions today. If you have any additional questions, please come in for a consultation. Your health is super important to us. Thank you.
Thank you.
Thank you.